Itiliti Health has taken an approach that the first step for solving prior auth for our customers is to make it easy for providers to know what the rules are, and that has a dramatic effect on the efficiency of both the provider and the payer. By sharing the rules effectively with the provider and giving them an easy system to go into to say, I'm going to perform this procedure for this patient on this date, it requires prior authorization or it doesn't, and if it does, what documents do you require? The impact of that was pretty dramatic in that, number one, because we're giving the provider a really good digital experience on the first thing that they need to do in prior auth, which is to know those rules, they're drawn to that system now, right? That's the place they're going to start. They get an answer that says they need a prior authorization quickly, and therefore what we're avoiding is without that system today, the provider is relegated to looking at 4,000 row spreadsheets and multiple spreadsheets for different lines of business and different dates, and that makes it really challenging. The result, if the provider takes the information incorrectly, is that the provider is not going to get paid. So it's really important to them. So if they don't have a quick and easy, confident source of truth for this information, they're going to either pick up the phone and call the payer and ask the question, does this require a prior auth, and what are the rules? And oh, by the way, I have you on the phone. Can I just submit my prior auth to you now on the phone? So that's a breakdown in process. By giving them a digital experience that answers the question quickly, we found at our customers, we eliminated 20% of all telephone calls from providers. If the provider doesn't have an easy source of truth and doesn't want to make a phone call, they can just submit a prior authorization. That way, they're sure they're going to get paid. They really don't care if it takes the payer a little bit of work to give them that yes or no, because to them, they're ensuring that they're going to get paid. So they're delegating the pain of the process on the payer. Well, that's actually pretty painful for the payer, because 30% of the time when providers submit prior authorizations, prior auth is not actually needed. And that's because, again, the provider doesn't have an easy way to know that the prior auth isn't needed, so they just go ahead and submit one. By implementing a tool at the very front end of the process that gives the provider a way to know, yes or no, it needs a prior authorization, we can eliminate 20% of telephone calls, we can wipe out 30% of all prior auths that are submitted, and we can improve the data that the provider submits. Another area of return on investment that we found in this process is that when providers do call the call center of the health plan to get that question answered, does it require prior authorization? The health plan call center answers that question wrong 30% of the time. What that means then is 30% of the time they tell people prior auth is needed and it's not. Those are a good problem. At least the prior auth is submitted and the process happens effectively. If they tell the provider prior auth isn't needed, but it actually is, the provider performs the service, the bill is submitted and rejected. And now somebody has to pay that cost. Usually, if the provider has done their work, they know who they talked to and what day they told them the answer. Somebody has to go pull the recording of that telephone call, determine that the provider is correct, that they were told they didn't need a prior auth, and now they can pay the claim, and the health insurance company is now paying a claim that they shouldn't have had to pay. We've found that number at our payer clients has been as much as $3 million per year of cost that the health plan has to pay for a very small health plan. So pretty significant amount of potential cost that comes from not having an accurate and clear transparency system.